Georgia says it would hope to have testing capabilities ramped up by the end of this week. Well, today they tell us it probably will be this weekend. CBS 46's Haley Mason has a look at what it takes to get a coronavirus test in our state and talks to a man struggling to get tested himself.
I've been in contact with the state health department today, and they're telling me that they're hoping to be able to test 200 specimens per day at the state lab by this weekend. Right now, the availability of tests and testing capacity has been a top concern for people who are sick. The state lab can only test 100 specimens a day. Jonathan Santana tells me he's been sick since last Thursday. He could barely talk, but insisted on telling me his story. He says he was diagnosed with bronchitis, but he says he has all the symptoms of the novel coronavirus. The only problem, he doesn't have a fever, and he can't be tested for free at a hospital.
I was at home with medication, but I still have the same symptoms. Was told that I was not to get the coronavirus because they're short and because I don't have a fever, but I have every other symptom. And a shortness of breath.
He was told to reach out to a private lab in Sandy Springs. The bill is more than $180. Did the hospital tell you it would be free?
They were told that if I took it in the hospital, it would be free, but since I don't have a fever, could not take it because they were short.
I called the lab in Sandy Springs and they tell me the shipping fees are true. They say they have to overnight this at-home test through FedEx on ice, so based on location, the shipping varies. Jonathan is asking for help. He's just one of many sick people who are struggling to be tested, being told to medicate and monitor at home. The state health department tells me that per DPH and federal guidelines, people are prioritized for testing. First, healthcare workers and first responders who are critical in caring for the nation and frequently in contact with vulnerable populations. Then people who are caring for vulnerable populations such as long-term facility staff. Then people who congregate in settings where the disease can spread quickly. And state officials also tell me that only people who have been evaluated by a healthcare provider and given a PUI number, that is a person under investigation number, will be referred to one of the drive-through testing sites. Reporting in Atlanta, Haley Mason, CBS 46 News.